Hi everyone, my lovely people. Good afternoon, good morning, and good evening to whatever time period you're watching me at. I'm Dr. Payal, the braces doctor, and I'm here to make your orthodontics learning little bit easy. Okay, so it's not very difficult to understand orthodontics. The point is we have to make little effort. So with you in your journey of learning orthodontics, I'll be there and I'll be helping you out in everything. So let's move on to starting with introduction to orthodontics. What is orthodontics? Orthodontics is the branch of dentistry concerned with preventive, interceptive, and corrective measures for malocclusions. Okay, so we'll be dealing with it one by one. What is prevention of orthodontics, what is interceptive orthodontics, and what is corrective orthodontics. Now moving on, who gave the term orthodontics? Orthodontics term was given by Le Fallon. Very interesting name, Le Fallon. Okay, so what happened was, and again, what is orthodontics stands for? Orthodontics come from the word orthos, and dontics, as you all know, means teeth. Understood? So this is the concept of orthodontics. Now in 1922, British Society for Study of Orthodontics has defined it as the study of growth and development of jaws and face, okay, particularly, and the body generally, as influencing position of teeth. Okay, so this is what it is, orthodontics. Now the point is, why we need to learn orthodontics? Why is it so much important? Okay, so we have to understand that I'll go to a new slide. So to understand that, there are some unfavorable sequelae of malocclusion. What is that? Now the point is, why are we learning that? See, when there is anything, when there is normal orthodontics and there is a normal alignment of teeth, it is very good. But sometimes not everyone can have a proper teeth, proper alignment. Okay, now to understand that, see, everyone will be having 32 or 28 teeth, right? Most of them will be having third molars extracted. In those condition, okay, we'll take it 28. Minimum 28 almost everyone will be having. Very few will be having, when some of you will be very new to orthodontics. For them, I will make this understand. What happens is, the teeth are not aligned properly. Okay, some teeth will be here, some teeth will be here. If I am, please forgive me for my diagrams, I am very bad at it. Okay, you see, there is, from the top portion, if I see, it will be, one will be here, one will be here, one will be here, one will be here. The incisal portion, you must be very familiar with the labial part, incisal part, lingual part, distal part, which is also the proximal parts. Okay, So I am this one is of mostly of incisal part. This is lingually. Okay, when this is happening, this is called, what will you feel if there are number of people, think there is a elevator with the maximum capacity of 4 people, but you are 6 people. What will you feel over there? Yeah, think. How will you feel? You'll feel suffocated, or some may call it as crowding. Got it? Same way, I have an elevator with maximum number of people of 4, but there are only 2 people. Will there be any space in between them? Yes, of course there will be spacing. So that is called spacing. Understood the concept of crowding and concept of spacing? So, when same thing, your mouth has the capacity of holding, for example, someone has space for only, for example, I say 26, but they have 28 teeth. So what will they look like? They'll look like as there is crowding. And if there is a space where they can accommodate almost 32 teeth, but there is only 28, so of course you will see some spacing. So concept clear of what is crowding and what is spacing? So now anything, if there is any crowding, spacing, or in this elevator some everyone cannot stand straight, right? They have to turn themselves to make the 6 people adjust over there, correct? So to make them adjust over there, some people have to turn, that is rotated. So in same thing, your teeth might be rotated. Okay, so if I say, so again I'll just make it clear for you. There is a elevator with maximum capacity of 4 persons, and if there are 6 people, so it might be very suffocated or called crowding. If there are 2 persons, there will be lot of space in between them, that is spacing. Okay, to accommodate here in this elevator, some person might rotate themselves, that is rotation. So if elevator is your oral cavity with a capacity of 38, and think persons as your teeth, if there is more teeth compared to the space available in the oral cavity, it will be called crowding. If there are less teeth as the space present in the oral cavity, there will be spacing. If there is any rotation, there will be rotation, correct? So that means it is not in a proper point. Okay, so in those conditions, it is known as malocclusion. Got it? Malocclusion. So So if there is malocclusion, there will be some problem. Okay, first thing, the patient or the person must not, they will not feel good, right? So poor facial aesthetics. Number 2 will be risk of caries. How? Now, if there are a lot of tooth, okay, in your oral cavity, there are a lot of tooth. If they're properly aligned, that means when we will be brushing, the brush bristles can clean properly, right? But if it is crowded, then the bristles will not reach every tooth surface, resulting in risk of caries, correct? Moving to periodontal problems. Same thing. If you cannot brush properly, that will lead to accumulation of plaque over here. The plaque will result in calculus. Calculus which further will break down PDL, which will further break down the bone. In perio you must have learned that, right? That plaque and calculus are harmful for us, correct? So there will be periodontal problem. Next will be risk of trauma. Now imagine two boys playing football. One has a very forwardly placed tooth. I'll try to show. These are the lower incisors. This is the upper incisor. The lips is here. The lower lip is here. Okay. Now this is boy number 1. And one more boy will be like this. This is the upper lip. This is the lower lip. This is boy number 2. And they both fell down. Just imagine whose teeth is going to break or has a chance of breaking more. Of course this one, because this tooth will fall and it will have a great impact on it. So this will break. So there is a risk of trauma. Next is abnormality of function. Now what function do you do with your teeth? We can deglute, we swallow, we speak, we respire. If there is a gap in between them, one second, I'll just remove this one. I will delete this one so that we can understand better that how is it is going to. Okay, so yeah, moving on. So it helps in swallowing. Now for example, one person has a teeth with gap like this, between the two tooth, and one person has a proper. So don't you think air will pass on through this? So they can have mouth breathing, correct? Second thing, I will ask you people to do that thing is, please keep your both the teeth apart. Okay, don't put it nicely, and then say the word Mississippi. Okay, like if I am closing my teeth and I am saying that, that is Mississippi. But if I am opening it, Mississippi, can you feel the difference between the speech, the way how I am pronouncing it? Okay, so that is how there will be abnormality of function. Next is, there will be TMJ. What is TMJ? Disorders. You know, TMJ is temporomandibular joint. When the teeth are not properly in contact, whole of the load, whatever we are saying or speaking, will move on to the TMJ, and it will cause a problem. And if all these things are happening, of course, it will have some psychological problem, don't you think? So, psychological problems. So, these are unfavorable sequelae for malocclusion, correct? Now, next, moving on to what are the aims of orthodontics? Okay, there is something called Jackson's triad, a very important question for UG people. This comes as a short note, a very short note. Lot of times you will see this question, what is Jackson's triad? So all the whatever we know that what malocclusion caused, right? So how are we going to treat it? So all the aims and objectives to treat orthodontic treatment has been summarized by Jackson as Jackson's triad. So we have to understand what is Jackson's triad. Make a triad. Triad is a triangle. So first you will put functional efficiency. Second is structural balance. Last is aesthetic harmony. Okay, so that means functional efficiency, whatever function we are doing, it should be improved. Means the speech, the shallow, that should improve. Structural balance, the maxilla, the mandible, it should have a balance. Aesthetic harmony means the dental and the aesthetic should have a proper harmony with each other, right? Now the condition is, sometimes what happens is people get confused between functional balance, structural efficiency, aesthetic something something, they'll write. Okay, so to understand how to remember, FESBEH. Okay, so functional efficacy, structural balance, aesthetic harmony. Now I'll give up you people a notes. Give me the way how you people remember the words. Okay, don't need to mug it up. Functional efficiency. How can function has a balance? Function cannot have balance, right? Only the structures can balance. Eiffel Tower can have a balance. Okay, but the person eating over there cannot have balance. It should be efficient. He or she should be efficient on eating the pizzas and burgers, right? And lastly is aesthetic harmony. So this is a very important question, comes as 5 marks question, 3 marks question, 2 marks question, sometimes even comes in MCQs. Okay, so that is aim of orthodontics, which is Jackson's triad. Now moving on to a new thing, which is what are the scope of orthodontic treatment? How can we correct the how can we correct? So first thing is we can alter the tooth position. Correct? Normal thing, very easy to remember. Tooth position can be changed. Next thing is alter the skeletal pattern. Third thing is alter the soft tissue pattern. So, three things: alter the tooth position, alter the skeletal pattern, alter the soft tissue pattern. Correct? Tooth means you will very well understand that we will change the tooth position. Skeletal pattern, if maxilla, if this is a block of maxilla, this is a block of mandible. Correct? Maxilla should be little forward, not more. If it is more forward, then it will not look nice. If mandible comes more forward, then again it will not feel nice. So that means we have to change it. This condition is known as class 1. If maxilla is coming forward, it is class 2. If mandible is coming forward, it is called class 3. Okay. Now, soft tissue. Only changing the tooth will not correct the person's aesthetic. Okay. The person's facial thing. So, we need to change the soft tissue also. So, what all services or orthodontic services means? What all treatment we all do? Is first is preventive orthodontics. Means action taken even before the things happening. Means they say it's prevention is better than cure. So if there is anything before the onset only, means if you are riding a bicycle, okay, and you are wearing a helmet, means you are preparing before even any accident occurs. You are preparing yourself that I am wearing a helmet. That is prevention. Second is interception. Means during the early age, if we are feeling that something might get wrong or full-fledged accident has not occurred, you are seeing, you are driving the bicycle, there is one more bicycle coming in front of you. So you are slowing down or you will apply brake. Wearing a helmet is preventive. Interceptive means you are giving a brake. Means it is you are trying yourself to save yourself. You know that accident might occur, so you have to do something, correct? So that is interceptive. Third is corrective. Means all the things you are going to do to correct it. Means you will change the path so that the accident should not occur. Okay. And last is surgical. Now accident occurred. Now you are going to surgery. Your hands has fractured. Your legs are fractured. You are going for surgery. Nothing can help you now. Okay. Only surgical thing so that you can be saved. The whole purpose of wearing a helmet, then giving a brake, then changing the route, everything was to save yourself, not the bicycle, right? So you are important. Every time, please understand, please remember, you are very important to yourself, to your friends and your family. Do not ever feel that you are alone. Okay, that's a very separate topic and a very sensitive one also. Someday I'll be like to talk to you about that. Okay, now these all are the services offered by orthodontics. So this is all about introduction about orthodontics. If you liked this video, you understood what was the concept of these things, then please like, subscribe and comment on the channel, and do comment me what chapters you will love to learn from me, or love to understand it from me, because I am not here to give you notes. I am here to make you understand the concept. Notes and written matter is already there in the book. Once you go back from this video and you read the things, give me only 15 minutes of your time. I'll make sure you will ace your orthodontic exams. Okay, so comment me, like and subscribe, and please share my channel so that everyone can visit and can see and can learn orthodontics. That's all for today's introduction to orthodontics. I'll meet you soon with the history of orthodontics, which is a very boring but a very interesting chapter. Tata, and be respectful to everyone. Thank you.